Yeah, I drove over here.
Oh, yeah.
Use my car.
Okay, so I'd like to cover something that's very important in breaking the chain of infection, PPE. Now, we all know what that is, right?
Personal protective equipment.
Right, and when we refer to PPE, we're talking about specialized clothing or equipment worn by healthcare providers for protection against infectious agents. Why is PPE so important?
It helps keep us safe in the healthcare environment.
And prevent the transmission of pathogens. There are a variety of options when it comes to PPE, starting with gloves. When are they necessary?
Whenever you might come into contact with blood, body fluids, excretions or secretions, mucous membranes, non-intact skin, or contaminated items.
Very good. Other equipment can include impervious gowns and aprons, surgical and high-efficiency particulate air masks, plus N95 disposable masks, face shields, and protective eyewear and goggles. So, when would you need those?
Whenever there's a situation where you may come in contact with or be splashed by contaminated materials or body fluids.
And just like with gloves, you have to make sure you not only put them on right, but take them off safely too, to avoid contamination and exposure.
Exactly. You need to anticipate exposure and choose the right equipment to minimize that exposure. Understanding the potential contamination hazards related to the patient's diagnosis helps with that. And it's very important that you are familiar with institutional policies governing PPE. So, how do you choose what PPE to use?
It depends on the type of exposure you anticipate and the category of precautions that are in place.
Very good. And what are the categories of precautions?
Standard precautions and transmission-based precautions.
Right. And transmission-based precautions include contact, droplet, and airborne precautions. So, whose responsibility is it to ensure proper PPE?
Ours.
Absolutely. It's the nurse's responsibility to enforce the proper wearing of PPE during patient care for members of the healthcare team. You have to make sure everybody follows proper PPE protocol to protect yourself and your patient. Deborah has to wear complete PPE to care for her assigned patient later today. Why don't you practice putting everything on, okay?
Okay.
So why will you be needing complete PPE?
Well, my patient has a wound that we're going to be irrigating, so there's a high likelihood of body fluid or wound material splashing.
So to begin, what do we do?
Clean our hands.
Right. Perform hand hygiene.
And then put on the gown.
This is an impervious gown, and it's important that you put it on with the opening in the back. Don't forget to tie the gown securely around the neck and the waist.
I've got your back.
Thank you.
If you are using a mask or a respirator, you would put it on next and then put on your goggles to protect your eyes. Deborah's going to use a face shield today instead. It replaces the mask and goggles. Put it on right over your nose, mouth, and chin. Make sure it's snug. Pull the bottom down nice and low to give you better coverage. This reduces exposure to splashing. Then secure the ties or elastic bands at the back of the head and the neck, okay? Good.
Does Deborah need headgear or shoe covers?
Sometimes it's appropriate to have protection over the entire body, but in this case, no. Next, we put on a pair of gloves. Make sure you extend the gloves to cover the cuffs of the gown.
So, no exposed areas, even sleeves?
Right. Okay, finally, you need to check for any exposed areas on the front of your body.
Looks covered to me.
Me too. This was good practice. So when you're in your patient's room and you have put on all your PPE, what would you do next?
Confirm the patient's identity, explain the procedure to the patient,
And continue with patient care as appropriate.
Very good.